Hello, my name is Shuntavia Johnson, and I will be doing my video on hybrid operating rooms. What are hybrid operating rooms? Hearing the word hybrid, one might assume I'm speaking of a hybrid car, which have become extremely popular in this day and age. But in this case, I'm speaking of hybrid operating rooms. Webster's dictionary defines hybrid as something that has two different types of components performing essentially the same function, and a hybrid operating room is just that. A hybrid operating room combines a traditional operating room with imaging technology like those of X-ray and MRI, which allow doctors to use real-time images to guide them through a patient's surgery. To the left is a picture of a hybrid operating room. A doctor is using it on a patient, and you see that they're in a regular operating room with extra technology like the imaging that you see. Patients' benefits of hybrid operating rooms are having shorter procedure times, less radiation, ICU care reduction, shorter hospital stay, and faster recovery. The past history of hybrid operating rooms include hybrid operating rooms were introduced in the 1990s but rose to attention in 2008. Now, this huge gap for adoption was due to high cost of the medical technology. The average cost of a hybrid operating room is $3 to $4 million, and most hospitals just don't have that much funding in their budget. But these days, more hospitals are implementing the hybrid operating rooms and are allowed to help plan and create the room in every process, which in correlation helps hospital efficiency. The present use for hybrid operating rooms. The first one being neurosurgery. In neurosurgery, hybrid operating rooms are used in deep brain stimulation. Deep brain stimulation is used for Parkinson patients. It helps reduce the amount of tremors the patient has. Doctors use an endoscope and microscope to help assist the surgeon during the surgery. And this picture is of two doctors performing brain surgery, and as you can see, one doctor is holding the endoscope or microscope, as I mentioned. The second is cardiovascular surgeries. One of the main procedures that hybrid operating rooms are used in for cardiovascular surgeries are the transcatheter aortic valve replacement, or TAVR. With this procedures, doctors use a catheter to replace faulty heart valves. They use the hybrid operating rooms to use a video monitor to appropriately insert the catheter inside the patient's faulty aortic valve. This is a picture of surgeons performing cardiovascular surgery in a hybrid operating room. As you can see, they have the imaging there to help them see what they're working with. The next present use of hybrid operating rooms is orthopedics. They use orthopedics with scoliosis or pelvis fractures. Hybrid operating rooms provide doctors with a larger field of view and clearer images with 3D capabilities during orthopedic surgeries. Now, this advances hospital efficiency because the patient doesn't have to transfer from floor to floor to get different tests run, like an X-ray or MRI or a CAT scan that a doctor might need. The doctor can do it all right there while they're in the operating room without having to go to a bunch of different floors. This is how it increases efficiency and also better patient care. And this is a picture of a doctor doing an X-ray on a patient during surgery. As you can see, he's on the outside and the other ones are inside the operating room as the surgery is going on, and he's doing an X-ray of the skull. The future aspects of hybrid operating rooms. Hybrid operating rooms will be going wireless. Including wireless devices will allow previously wired connecting points to be able to rotate a complete 360 degrees at any location in the operating room. Also, if equipment needs to be repaired, The particular piece of equipment could be fixed or sent off for repair, while the rest of the operating room can still be continued to be in use. So going wireless is extremely important in this case. The second future aspect is robotic integration. Once upon a time, robots were just ideas in sci-fi movies, but in this day and age, robots are actually being used, and hybrid operating rooms are taking advantage of that. The hybrid operating room will improve catheter accuracy, stability, and safety. Also, they'll be using a C-shaped arm, as you can see in the picture to the right. That's a C-shaped arm that would be the robot that the doctors will be using. And the last future aspect is joint commission requirement. With hybrid operating rooms being so successful, they will soon not be as rare as they are now. Soon, every hospital will be equipped with hybrid operating room capabilities. Chief of Cardiac Surgery at Stanford Hospital, Michael Cody, says less invasive technologies are becoming mainstay in terms of the way in which we treat patients, which it says a lot. So soon, the Joint Commission may add this to their list of requirements for a hospital to get Medicaid and Medicare benefits, which is a huge thing in medical care this day. A couple of things to wrap up the topic. Hybrid operating rooms can help in cardiosurgery, neurosurgery, and orthopedic surgery, as I mentioned earlier, and are becoming highly popular in today's hospitals. Hybrid operating rooms have exciting future developments in the works, like wireless technology and robotic features, which are both exciting. Both of these can add to the list of surgeries that can be performed in the operating room. So, hybrid operating rooms are advancing every day as I speak. While hybrid operating rooms may have been an idea of the future, the concept is here in the present and increasingly being used. It is safe to say hybrid operating rooms are not going anywhere and are here to stay to help current generations and future generations. And that will wrap up my video on hybrid operating rooms. I hope you enjoyed. Thank you.